Welcome back to Ask Zai, where we're learning together as we're growing as one. This channel is all about building a community and getting you guys the answers that you need. So right now, I'm trying my best to get you guys ready for the HSPA Sterile Processing Exam. If you are interested in learning more about how to pass the exam, go ahead and make sure you follow so you do not miss any of my upcoming videos. Also, make sure you follow me on TikTok so that you don't miss any of our lives because we're going to be doing Kahoots, practice questions, and also we're going to have community discussion. Why not network? You might even find your next job, especially if you're trying to travel because them recruiters definitely be in the lab. So yeah, let's go ahead and get into it. Today we're going to be talking about infection prevention. Sterile processing technicians play a vital role in the prevention of infections of surgical sites and healthcare acquired infections. Poor patient outcomes can be traced back to many different factors, including the condition of instruments, trays, and other devices processed in the sterile processing department. Infection prevention principles are based on the knowledge of nature and characteristics of disease producing organisms. This includes an understanding of how they are transmitted in the healthcare environment and their place on the chain of infection. Sterile processing technicians must make sure that everything that comes through our department is completely disinfected and sterilized. This is why understanding asepsis is important. Asepsis is the absence of microorganisms that cause diseases. Aseptic technique includes any activity or procedure that prevents infection or breaks the chain of infection. There are two different kinds of aseptic technique: medical asepsis, and surgical asepsis. Medical asepsis are procedures that are performed in order to reduce the amount of microorganisms that are present to prevent the spread of them. This can include hand washing and equipment decontamination. Surgical asepsis is procedures that are used to eliminate all presence of microorganisms and or introduction of microorganisms to an area. Some examples of this could be storage techniques used in the OR or proper processing. 5 basic principles of asepsis is: 1. Know what is dirty. 2. Know what is clean. 3. Know what is sterile. 4. Keep dirty, clean, and sterile items separate. 5. Remedy contamination immediately. Hygiene and adherence to dress code protocol are important components of infection prevention. Hand hygiene is the most important factor of preventing infection. Hand hygiene is the act of washing your hands with soap and water or using alcohol-based hand rub. Most of the sterile processing area is semi-restricted, and sterile processing technicians must wear clean scrubs provided by the facility. It is important to wear the facility provided scrubs because it protects the patients, their family, and the staff. If you're using detergent from your own home and trying to reuse the scrubs from the facility, that's not good practice because the detergent you use at home is completely different from the hospital detergent. Attire should be clean and not worn outside the facility. Once you come to work, you will change from your street clothes into the facility provided scrubs. Jewelry included necklaces, watches, and rings or bracelets should not be worn in the facility because they could be harboring microorganisms. Some jewelry can also accidentally fall into the instrument trays. Basic attire should be worn by everybody who is entering the sterile processing area. This means anybody who is coming into the sterile processing department must change into these facility provided scrubs, even people entering just to clean or do repairs. A disposable head covering should be worn over all of your hair except for your eyelashes and eyebrows. If you decide to wear a hair cover like a scrub cap from home, then you have to make sure that it's covered by the disposable hair cap so that you are not bringing in any germs from outside of the facility. Beard covers should be used to cover mustaches and beards to prevent shedding of hair into the instrument trays. Also, you should be wearing sturdy, non-skid, closed-toe shoes. You don't want to be wearing any cutesy shoes to work because it's very important that you're protecting your feet. Imagine if you have these sharp surgical scissors and you drop them. You want to make sure that your feet are protected. Also, when working in the sterile processing unit, you have to wear a scrub jacket. These jackets are there to protect you and to protect everybody else. As I said, all of these policies are to protect you, the patient, and other staff. Okay, so now let's get into decontamination attire. OSHA is the primary federal agency that is responsible for occupational safety and health legislation in the workplace. OSHA required PPE is necessary for the decontamination space. This includes gown, 2 pairs of gloves, which includes a regular pair of gloves and a heavy duty glove. You have to wear a mask, face shield, and shoe covers. OSHA published the blood-borne pathogen standard to recognize the potential of occupational exposure to blood-borne diseases. The standard requires the written exposure control plan that summarizes the employer program for the protection of workers from occupational exposure to blood-borne diseases. I'm going to provide a list of everything that is required of the ECP in this next slide. So if you want to take a screenshot, get ready. Okay, so the use of positive and negative air pressure helps to reduce the likelihood of spreading airborne illnesses. So the decontamination area has negative air pressure, while the clean, sterile area has positive air pressure. Whenever these windows or doors are open, the air pressure from the clean side is going into the decontamination side instead of vice versa. To maintain the pressure of these two areas, it's important after you're using these windows or doors that you close them to keep the clean area positive pressure and the decontamination area negative. There are also temperature and humidity and air exchange requirements for the sterile processing area. This will be controlled by the HVAC system of the facilities. Sterile processing technicians must also reduce the amount of contaminants in the area, such as dust, lint, and bacteria. Sometimes lint that is left inside of the tray can end up in the patient, and that can cause a healthcare acquired infection. This is why it's important to inspect your items and take your time. Inanimate objects that transmit bacteria are called fomites. Common fomites in the sterile processing area are doorknobs, keyboards, mouses, pens, etc. Food and beverages should not be in the sterile processing area. First of all, that's nasty. And it's to protect you. If you feel like you need a break, just ask for one. You can go run out to your break area and go and get you a snack. But do not try to sneak food on the unit, because not only are you putting yourself in danger, but you're also putting the patients in danger. So that wraps up our infection prevention chapter. This is chapter 5 in the book. If you have any other questions, make sure you comment below. Don't forget to leave a like on the video. And thank you so much for visiting the channel. I can't wait to see you next time. Bye, y'all.